on human beings and also the animals, we are directly applying these outcomes to the individuals to know the behavior of the individual. Nowadays, it is very important to know the behavior of an individual, so that makes some meaningful interpretation, meaningful understanding, and by that the person can improve his ability where he fall below the line. So health psychology means the principles which are formed in the psychology directly applied in the field of health. So that is called the health psychology. So that we are dealing with from previous 5 classes. So now So now, in the health psychology, previously we had know the what is mean by stress, what is the stressor, what is the psychological aspects of the stress, and are the physiological aspect of the stress. What is mean by coping mechanism, then how to deal with this stress, how to adapt coping mechanisms. If continuously produce stress means that may somewhat difficult. So already we know that. Today we'll see the today we will look into pain management and healthcare interventions. What is mean by pain? So psychology dealing with the mind and body. So mind and body are not separate things. At least in the term they're functioning. If there is one thing that this intended to teach you. So there are something different. This is a physical body and the mind. Mind will think and it will help the thoughts or whatever it is. So for an individual, health is important. If a person suffering from some disturbance, it will affect his mental health also. So already we know that according to WHO, World Health Organization, there is a complete absence of physical and also the mental illness is called health. There is no any physiological symptoms and as well as the psychological discomfort, whatever it is. If a person suffering from psychological illness, it will affect physical health also. So because of that, the health psychologist is the healthcare is the key concern rather than the illness. Therefore, anything that leads to and maintain the health likely to be researched by health psychologists. Huh? So we are seeing some people, they will say we have healthy lifestyle, and some people have lifestyle that actually discourage the health leads to illness. That means physical and psychological. So in that interventions to promote the health can encourage the practices of the health behavior. Huh? So we have some uh, there are so many methods are there to improve the health. So how to maintain the health. So here we look into pain. So what is mean by pain? In a pain, so the types of pains and the psychological aspects of the pain. Huh? So we'll see. So pain is somewhat discomfort and unpleasant experience, which is subjective in nature. So the pain, what it happens, pain hurts and it affects other basic needs of an individual. So it will affect the basic needs of the individual. So we do experiences in our life, we do experiences at different point of time in life. So we can experience in different types of the pains. Huh? For example, a mother gives the birth. So during the labor, so she produces a lot of pains. So it is horrible to give a birth to a child. So he experiences a lot of pain and discomfort. Huh? So a baby teaching, and injury. Some injury, some brokens, some accidents. Huh? So these are the some of the examples of the pain, and it is important to experience pain as a pain indicators the low level of functioning of the body. So medical consequences are associated with pain. Pain indicators underlying cause of helps us seek medication treatment after identifying the cause. So medical experts they will identify what exactly the cause, what where it is happened, huh? What is the physiological symptoms. So so like that they will evaluate and they will give some treatment to reduce that pain. The pain as a physiological and medical significance. It has two significant importances. One is the physiological, and also the other one is the medical significance. Anxiety tends to owns the pain. Anxiety also sometimes it leads to pain. Pain experienced can be dull or sharp. Some may feel pain due to the burning sensation. కొంతమంది say they will feel burning sensation. Some may feel pain while itching. So itching means some చూడదా ఇట్లాంటిది కావచ్చు itching. Some may pain may be itching or probing అంటే అట్లుంటుంది. So painful conditions differ with the origin and the duration of the pain. Some people may have developed pain discomfort and also the pain disorders in now people experiences pain of a long period of the time with uh, physical blasting. So it can defect cause of the pain. Some the chronic pains. So they will we can see some old age peoples. So the knee joints and the bones, huh? They have deteriorated and they produce frequently pain while standing, while moving, while sitting, huh? Like they will get this type of pains. Pain is an unpleasant sensory and emotional experiences. What the definition? If we see in the definition of the pain, so pain is an unpleasant sensory and emotional experiences causing discomfort in the presence of tissue damage or injury. So here is the tissue. Body made up of several tissues. So in the pain, we can observe. So major thing is the damage of the tissue. So tissue damage will occur due to the injury. So pain is experienced by people across all the age groups. So it is not bonded to some group of people, some age group of people. So pain can experiences by across all the age groups from birth to death also. So anyone can get the pain. Some pains experienced are acute, such as light headache. Some pains are acute, so they are sometimes we'll get some headache, slight acute, while some pain experiences are chronic. Some are acute and some are chronic. So we can classify this. So headache it is not a chronic problem. It is an acute. So it will remain 1 hour, half an hour, or 1 day, or 2 day. So depending upon the experiences of stress or physical discomfort. So and also the some some are the chronic, such as chronic. We are acute and we are divided into acute and chronic. So acute means some small headache, small pain in the tissues that may be leg, hmm, or foot, or hands, wrist, like that. So some of the chronic pain associated with arthritis. Just now only I given an example in the old age. Some may get frequently pains in the joints, in the legs, in the palm or hands. So like that, in the spine. So like that, some associated with arthritis and migraine, etc. These are the migraine also. It is a chronic pain. Huh? So the degree of pain experienced by an individual differ from a person to person. సో ఇది ఎంత ఉంటుంది అంటే అందరిలో ఒకే విధంగా ఉంటుందంటే దెర్ ఈజ్ నో सब पूरा पूरा में एक ही रहता नहीं. So एक एक इंडिविजुअल को अलग अलग रहता. Some may get individual from the person to person, pain experiences by an individual from the person. It is a subjective in nature. It may not be directly in the proportionate to the damage of the tissue caused. So this is the pain. Most of the people visit a doctor are those who are experienced pain or some reason or others. So what we do, if we get pain, we'll go to the doctor, or general physician, or the orthopedic doctor, huh? And we consult and we took proper suggestions from them. So 80% of the people seek medical help only when they experience pain. So minute, even in the minute form of the pain, they won't go, they won't consult the doctor. So when he will consult the doctor, if we get 80% of the people, 80% of the people will seek medical help when they experience pain. Huh? So pain is only the most common medical complaints, and its severe and prolonged pain can be cause discomfort or impair general or social functioning, emotional adjustment, and the social relationships, and the low back pain. Huh? So most caused pains are found in the work room. So where we can see those who are doing work frequently, huh? After studying, after doing job, often in that group, we can observe, we can see in these pains. So it differ from measures intensity pain individuals. So the pain depends upon the emotional state of an individual also. It depends upon the emotional state of the individual also. So and also the circumstances in the pain which acquired, etc. The pain prescription depends upon the factors such as arousal, attention, and distraction, and expectations, and also the sympathetic arousal influences of the experiences of the pain. Stress and the psychological distress can be uh, aggregative and pain discomfort. Actual components of the play a role in experience and in the threshold of the pain. So pain in general interferes with the uh, what it activates. If a person will get delay the activity, he cannot perform other works. So the daily activities and the goals and the sleeps, all these will affect a person's in the if a person will get they will get problem. So they affect the person psychologically, and the pain can be organic and psychogenic. Organic pain is linked to tissue damage or pressure. So example, burner sprains, and the pain that can then that does not involve any tissue damage, and the cause of the pain unknown, with the medical examinations fail to find organic and basis, then it can be known as a psychological. So in the medical examination, they don't find if any root cause. So it can be known as a psychological pain also. So this is the pain. So and also the types of the pain. Types of the pain. So already we'll discuss the acute pain and also the chronic pain. Huh? So these are the two types of the pains. So and based on the length of the experiences of the pain a person has experienced. So the most of the people experiences is the pains are temporary. Some people they will experience only temporary pain, while subsidized with the with or without medication within a few days, so few weeks. For example, headache due to stress, lack of sleep, huh, and the muscle strain and the small wounds, so etc. Pain can be classified into acute and also the chronic pain. So acute pain refers to the pain that is temporary, and the condition that it lasts for less than few months. So it will seen in less than 1 month, less than 30 days. It is a temporary condition, and the acute pain results from tissue damage. You can see what it is. It is a tissue damage or disease or inflammation Inflammation means reducing the pain or like that, or injury. The acute pain may also be result or trauma or injury, may be accompanied by anxiety or emotional distress. Pain with acute pain experiences higher level of anxiety and distress when the pain occurs. The distress sub subsidize the degrees in the pain. So all this is called acute pain. Acute can become chronic pain also. If we neglect, that can lead to chronic also. So basic ga we can see in it is acute pain. Uh, so it long last within the 30 days. In a 1 month, few days to 1 month, less than 1 month. So in that we can see in trauma, injury, maybe complications. So that this is an acute pain, and as the chronic pain, it is called the chronic pain when the pain lasts for more than expected course time. The environmental and the psychological factors can make the chronic pain worse. And so environmental and also the psychological factors can make it as a chronic pain also. So the chronic pain persists for a long period of time. So it persists a long period of time and resistant to many medical treatments. And also though it is resistant to the medical treatment also. So we can see in old age people, they will took some pills, painkillers, even though they are getting pains while using that medicines also. So the pain persists of the long period of the time and resist it may medical treatment also. So people chronic pain suffer from more than one painful condition. People with chronic pain continue to experience higher level of anxiety and tend to develop helplessness and as well as hopelessness. Okay, if they're getting body aches, pains, they can't sleep, they can't eat, huh? They can't take rest. So, and these are all produce psychological imbalance in the body also. So, if there is no sleep, what will happen? So, we will face lot of problems, huh? Helplessness, hopelessness, and the pain is resistant to medical treatment also. So they will put pills, and then they develop their resistant power. Huh? If they use the tablet also, they won't get any benefit. They won't get any benefit. Only they are taking that painkiller, huh? taking consuming regularly. It leads to resistance to that medicine also. Huh? And there is no, even though they use the tablet also, they will won't get any benefit. So the chronic pathological process that either cause continuous pain or cause pain that occurs in the intervals of the months of the years. The underlying cause for the chronic pain also plays role under understanding the main the cause of the pain. Some of the chronic pains may be begins harmless, malignant injuries, and also the worsening, so causing discomfort continuously or occur in the frequent episodes. So based on on these factors, chronic pain can be subdivided into, again we can subdivide it into this chronic pain into chronic recurrent pain, chronic intractable begin pain, and also the chronic progressive pain. So They are dividing into pain into acute and chronic. So in acute, there is no subcategories. In chronic pain, there are the three subcategories. So one is the chronic recurrent pain. This pain stems from the being cause. It occurs in intense and repeated episodes with pain-free intervals. Example, chronic recurrent pains are migraine headache, tension headache. So these two are the examples of the migraine pain and also the tension related headache, also a chronic recurrent pain. So recurrent they will get, recurrently they will get. Huh? They will get today, tomorrow, day after tomorrow, huh? After 10 days, after 1 month, like that. So the chronic intractable pain, this pain is present all time causing discomfort. Here the intensity of the pain differs. The pain is not related to any malignant condition. Example, chronic low back pain. Chronic low back pain is an example for this chronic intractable pain. Uh, and third one is the chronic progressive pain. So this pain is experienced all the time and is associated with malignant condition. As the underlying conditions worsen, the intensity of the pain increase. For example, rheumatoid arthritis and also the cancer. So these two are the chronic progressive uh, pain. So another aspect is the bio psychosocial aspects of the pain. So biological aspect of the pain, neurochemical plays an important role in the pain. So the neurochemicals are linked to the psychosocial progress. Huh? Analgesia is the inability to experience or feel pain. Stimulation produced analgesia is known to occur. The chemicals produced by the neurotransmitter block the pain fibers. Stimulations to the uh, so in the gray area occurs. So you can see in the nerve study the inhibitory and inhibitory intraneurons. So there is a neurotransmitter in the spinal cord activating the neurotransmitter serotonin, which is activated as a nerve cell inhibitor. So like that, it will happens. The uh, neuro neurons produce endomorphin at the pain fibers, which inhibits the release of substances P. This can be seen in the below figure. So endomorphins are the anti-analgesics. They control the pain. Huh? Endomorphins belongs to the family of the uh, endogenous products within the body. So they will produce within the body also. Huh? Like opioids, uh, the opioids and opiates play a role in reducing the pain. Central nervous system consists of nerves that we have receptors that are sensitive to uh, opioids and opioids, allowing the chemicals to bind to them. The researcher as to so you can see in here uh, in the figure uh, you see. So here is the pain fiber. Huh? So it is in brain. Brain is there. So every response will go to where it is actually happened to the to that place to brain also. So through the spinal cord, in the spinal cord there are several nerves are there. So here the pain fibers, substances, substance P will produce, and it will transmission of the cells, and the pain message will enters into the brain. So brain ఏం చేస్తుంది? The brain will produce serotonin. Huh? So the inhibitory intraneurons. Huh? So like that they will go the path. Huh? So endorphins release and the pain will reduce. So taken this is an biopsychosocial interactions. Senifo and the Smith 2014 law, he explained by using this spinal cord the diagram. So how it is appeared directly. So psychological aspects of the pain. So even though so we learn to associate the pain with the antecedents, causes, and consequences. For example, a child who has visited a doctor for taking the shots, remember, and start crying the moment, huh? He sees the needle. So whenever we took a child to the doctor, so whenever he hold the syringe in his hand, so the child will recognize previous experiences. So doctor will give this injection. So whenever he give the injection, will get the produce the pain. So because of the past experience, while he's seeing that syringe also, while seeing his doctor also, white coat also, eh, so he will run away from that place, and also the he will cry a lot. So like that, uh, his reaction is an anticipation of the pain which he had learned before through the classical conditioning. So when he was given shots before, many individuals will be able to tell they are going to have sore throat and headache cause they experience the symptoms that perceive pain. So in these symptoms, we know to be conditioned stimulus and produce distress and may heighten the perception of the pain as a conditioned response. When the pain occurs, pain behavior is when people behave in a particular way. Huh? For example, people in the pain may show behavior such as huh, moan and limp, huh, and also the like that extra. The pain behavior can be classified below. So how the experience and the experiences of the distress, the facial or auditory, and clenching of the teeth and mona, and the discorded postures, heading or touching the pain areas, lumping and moving in the god. So these are the negative emotions, irritations, frustrations, avoidance, staying home from work, uh, refrain from certain activities, pain behavior at a time, maybe uh, like that. The social process of the pain. In the social process of the pain, the people in the received care, attention and the affection is the general form of all the reinforcement pain behavior. In an experiment conducted, children scattering increased when they receive their parents' attention, telling them not to stretch, and the parents who had distracted their children from the pain behavior saw their children's report less pain, faster recovery. The parents who paid attention to the pain behavior symptoms of their own children. Some of them they experience some cultural and general gender differences found in the experiences of the pain. So, ఇది cultural and general differences will seen. Huh? So, a study conducted on the cold pressure test showed that women rated more pain than men. So, women get more pain than men. Who said this? So, this is Rollman and Serfino and Smith అనేటువంటి వాళ్ళు invented, who have also rated high pain from arthritis. So arthritis also they will get you severe pain. So it is horrible. So the joints will not like this. It will go here, here. So and cracks will absorb. The bones also bending towards inside or outside. So like that. Uh, so these are the some of the examples. So so it was seen that the blacks reported more pain than Europeans and the Asians and the Hispanic after dental surgery, with women reporting more pain than men. So men కంటే women ఎక్కువగా పెయిన్స్ వస్తున్నాయని అనుకుంటున్నాను. In American, whites showed more tolerance for pain, for muscle ischemia pain than African Americans. So emotion also affect the pain and also the pain behavior. People with chronic pain experiences anxiety, anger, depression. Huh? So more people with chronic experiences, they will get more anxiety, more anger, and more depression. So because of that, if we reduce anger, depression, and anxiety, a person will not get pain. So himself, he only control his pain. So perception of the pain involves neurochemical and psychological events that affects the psychosocial process. Huh? So the learn people learn and the prescription social experiences affect. Huh? So like that. So it is this is somewhat related to the pain management. So in pain management, surgical methods for treating pain. So here, not all the pains that experience need medical help. అన్ని పెయిన్లకు కూడా మెడికల్ హెల్ప్ అవసరం లేదు. సో కొన్ని వాటికి ఖచ్చితంగా కూడా మెడికల్ హెల్ప్ అనేది ఖచ్చితంగా కావాలి. Some pain such as chronic pain needs to be medically treated. So chronic clinical pains is known when a medical or professional help is required due to treatment that pain. So this pain may be acute or chronic. So when a acute pain, ఎవరైనా acute pain ని ట్రీట్ చేయలేకపోతే it will turn into chronic pain also. It leads to chronic pain. So because of that, while in acute pain only we can address properly, it can reduce the other. So the discomfort shown aggressive behavior, they begin the perceived nature of the pain differently. Some of the individuals might also want to change their doctors also, which at times might be constructive for them, to deal with pain. The pain become chronic. People experiences or loss of self efficacy and performing activities, and the fear certain conditions may also worsen. So like that. The surgical methods for the treating pain, uh, in this method, one way it is remove the portion of the peripheral nervous system or the spinal cord through a surgery, thereby preventing the pain signals from reaching to brain. సో ఏదైనా కానీ మనకు బ్రెయిన్ నుండి వెళ్తేనే కదా చేసేది. సో ఎక్కడైతే ప్రొడ్యూస్ అవుతుందో అక్కడ దే విల్ పర్ఫార్మ్ సర్జరీ అండ్ దే విల్ రిమూవ్ సమ్ టిష్యూ అండ్ ద నోవ్స్ ఆఫ్ దట్ పార్ట్. సో బై దట్ during the surgery he can stop the signals that place to brain. So like that, the treatment will go on, and after the treatment done you will not get any pain. So in other surgical methods, the portion of the nervous system is not removed to relieve the pain, but through surgery membranes that becomes inflamed in the arthritic joints are removed. This technique is known as సినోవెక్టమీ. సో సినోవెక్టమీ అనేది ఏఎంఏ 2003లో కనుక్కుంటారు. అండ్ ఆల్సో ద కెమికల్ మెథడ్స్ ఫర్ ద ట్రీటింగ్, అండ్ ఆల్సో వన్ ఈజ్ ద సర్జరీ మెథడ్. సో సెకండ్ వన్ ఈజ్ ద కెమికల్ మెథడ్. దిస్ ఈజ్ మోస్ట్ కామన్ మెథడ్ ఆఫ్ రిలీవింగ్ పెయిన్ త్రూ అడ్మినిస్ట్రేషన్ ఆఫ్ ద డ్రగ్స్. మనం చూస్తున్నాం కదా, దీన్నే పెయిన్ కిల్లర్స్, లైక్ దట్ they use some painkillers or whatever the pills అంటున్నాం కదా, మెడిసిన్స్, డ్రగ్స్, pharmaceutical drugs are very effective in relieving the pain after surgery. సర్జరీ తర్వాత కావచ్చు, సర్జరీ ముందు కావచ్చు. If a person will use these tablets or medicines so to reduce the pain, these drugs and the doses are given by the physicians after looking into many factors such as intensity. Pain యొక్క intensity ఎంత ఉంది, and some the location of the pain, where it happened. So painkillers are also given, but in the dosage under the recommended level. So doctor will see the height and weight, monitor, and managing chronic pain can be done. Drugs prescribed by the doctor. Using opioids to manage pain caused by cancer is widely accepted today. ఈ ఓపియాయిడ్స్ అనేటివి క్యాన్సర్ ట్రీట్మెంట్ వల్ల ట్రీట్మెంట్లో వచ్చేటటువంటి పెయిన్స్ని తగ్గించడానికి కూడా ఈ ఓపియాయిడ్స్ను యూజ్ చేస్తున్నారు. యాక్సెప్టెడ్ బై టుడే. And some behavioral methods to reduce the pain, such as operant approach, can be used to modify the patient's behavior towards the pain. Example, rewarding a child for not crying, looking at the injury, monitoring their pain, so behaviors, etc. Relaxation method, and also the biofeedback is the most important. So ఈ విధంగా, so this is somewhat related to అది. So and also we can see in some techniques. One is hypnosis. Hypnosis can be used to manage pain. Hypnosis also, in this also, we can, it is a many other therapies such as stimulation therapy, acupuncture, where fine needles are inserted at certain point of stimulated the area, and as the physical therapy, massage, applying heat, massage also relieve pain, applying hot and the cold uh, water also can be used to treat manage pain. మనం చూస్తుంటాం కదా, హాట్ వాటర్ కానీ కోల్డ్ వాటర్ కానీ పెట్టి ఐస్ గడ్డలు పెట్టి పెయిన్ కూడా తగ్గిస్తారు. ఇంజెక్షన్ ఇచ్చినప్పుడు ఇఫ్ ద గెట్ చైల్డ్ గెట్ పెయిన్, సో దే విల్ పుట్ బరఫ్ ఐస్ and the above of the where the injection is vaccine is given, the swelling will come, and it is hot in that area. uh, so like that the chronic pain. There are the many pain management programs that are available for the pain to use. The pain management programs aim to enable people to reduce manage pain and increase their activity level, and also continue with their everyday work. So ఇది ఈ విధంగా దిస్ ఈజ్ ద పెయిన్ సంబంధించినటువంటి So now we'll see healthcare techniques, how to reduce the pain. In that, relaxation training, biofeedback, behavioral modification, cognitive behavioral techniques, crisis management, yoga, meditation. So we can see, we can adapt all these. Please wait a minute. So in this, to reduce, WHO defined the healthcare interventions as an act performed for with the on behalf of the person, the people, those who have. So దీంట్లో రిలాక్సేషన్ training. So in the relaxation, it is the state that the gradual decrease in the tension that is expressed by the individual in the mind and the body also. Tension can be defined as a state of physical and stiffness, and the pain, and also the emotional reactions. So physical relaxation works towards the subduing these tensions and relax the muscles. So relaxation training refers to a group of strategies create help the people automatically to release the tension, any tension, and relax both mind and the body. By this, body and also the mind relief from this, so that thereby they will overcome the pain which actually they produce, where they produce, so where they have got. The relaxation technique includes including a number of practices such as guided imaginary and biofeedback and progressive relaxation, self-hypnosis, and the deep breathing exercises. These are the some of the techniques. So to overcome that. So the goals of these practices is to generate the body natural relaxation. So response wise, slow breathing, low blood pressure, and increase well-being. psychological relaxation occur when the mind is free of stress and distraction. Relaxation training was created in the 1930 ఈ విధంగా చేస్తారు అన్నట్టు. సో ఇంకొకటి, అండ్ ఆల్సో ద ప్రోగ్రెసివ్ మజిల్ రిలాక్సేషన్ టెక్నిక్ ఈస్ గివెన్ ఇన్ యువర్ బుక్. సో అకార్డింగ్ టు దట్ you can practice these. So gently tense chest muscles and abdomen without holding the breath. So where first one tense the face muscles including the head, cheek, mouth, upper neck and relax. So gently roll head from side to side with awareness of the tightening muscles and relax. So to and as a three, tighten shoulders and release, and so tense right arm. So ఇందులో ఉంది, you can according to that you can practice this one. And also the biofeedback, behavioral modification techniques. బిహేవియరల్ మోడిఫికేషన్ టెక్నిక్స్ మనకు ఉన్నటువంటి ఏది ట్రయల్ అండ్ ఎర్రర్. ఎడ్వర్డ్ లీ థార్న్డైక్ ఆల్రెడీ he gave some three learning principles. By that this theories emerged. The behavioral modification is a therapeutic approach that is designed to change the negative behavior. Negative behavior ని చేంజ్ చేసుకోవడానికి ఈ behavioral modification technique will help. The principle of the behavioral modification is based on the behavioral perspectives of the operant conditioning ఏదైతే ఉందో దాని ద్వారా కూడా దీన్ని తీసుకొచ్చారు. And the behavioral modification seeks the change behavior by analyzing the stimuli and the response actions. Stimulus response action ని కంట్రోల్ చేసుకుంటూ ఏం చేస్తుందో అది చేస్తున్నట్టు. ఆపరెంట్ కండిషన్ వర్క్స్ ఫ్రమ్ స్టాండ్ పాయింట్ that the best way to understand the behavior of the person, it is to look at the response stimuli for action and also the consequences for said actions. So it is in this the modeling technique. This technique entails teaching an individual to follow certain behavior. For example, when an employee joins an organization, he is asked to follow a honored employee, and queuing, discrimination, substitution, and fair reaction. Reinforcement and also the punishment also will help to reduce shaping. Shaping is apprehending condition. Successive approximation. In the Skinner apprehending conditions, he used to approach Kalla as a shaping. Instead of rewarding only the target behavior in the shaping, we reward successive attempts. After successful attempt only, he will give the reward or behavior that includes to increase of the target behavior. In the shaping behavior are known broken down and to the smaller tasks in order to achieve desired behavior. For example, a child is taught how to write. So on the completion of the every instruction, the child able to write the letter. When the positive reinforces use, they increase their desired behavior. And also the cognitive CBT also. So like that, ABC model. Crisis management, prevention, preparedness, and also the response recovery. So all these four preparedness cycle includes preparedness, response, and recovery, and imitation. So preparedness is the focus on the creating plans, exercise, training aids of the distress and emergency planning, and with all these all allow reducing the loss of the life and the sustain by all challenges by the developing the specific plan and emergency management protocol. And also the preparedness, it is continuous cycle for the activities such as assessment of the presence of the disease, illness, cause factors, and disease and the treatment and the preparedness. Like this. Response is measured taken by deal with the crisis at head and so recovery also. Yoga and meditation. So in the yoga also, what is yoga? Hmm? Some these are the techniques yogasanas will perform. Huh? So yoga and the meditation is used to prevent the treat medical conditions. The physical elements of the yoga are important, uh, effective for strengthening the body. What they do, they strengthen our body, huh? Which incorporate appropriate breathing techniques, mindfulness, and the medication in order to achieve better health. So the benefits of the yoga are manifold, such as regulation of the blood glucose level, improve the muscle skeleton and health cardiovascular system, the physiological benefits of the yoga and the meditation increasing the mental energy. They will give some strength into the mental energy and the positive feelings, uh, and decreases the negative feelings of the aggressiveness and the depression and also the anxiety. So yoga through originates in the Eastern cultures as inflated not in the Western cultures medicines. And also the meditation. Meditation means, so meditation can change the both the structure and the functional of the brains, and the researchers have proven that people who meditate have more robust brain structures. And also the mindful meditation increases the uh, cortical thicknesses and the gray matters, specifically in the area controlling the emotional regulations and the excessive functionings like in insular and uh, prefrontal cortex. Medication and help increase the thickness of the left hippocampus also. So like this, they will use disorders of the mind and the body such as Down syndrome, Alzheimer's, and the backaches, arthritis, restore balance, coordinate anxiety and depression also. So like this we can control. Uh, and another one is the last one is the what is this? So health and well-being. So if a person have health only, he will be good person. Health and well-being is very important. So quality lifestyle maintain చేయడానికి, so he had to improve his lifestyle also. So like that. So go through once this one also. So this the need of the goal satisfaction theories and also the we can't prepare. So up to this, we can complete resilience. Resilience is there. Resilience. self-efficacy, personal vision, and flexible to adapt and organized, problem solving, interpersonal, social connections. So all this will come in this. So up to this, we completed this topic 14, 13, 14, and 15. So